Hello, my name's Rob Webster and I am the Chief Executive of South West Yorkshire Partnership NHS Foundation Trust. I'm also the Chief Executive that's leading on something called our Sustainability and Transformation Plan. The Sustainability and Transformation Plan, or STP, is a local plan which tries to address three gaps that exist in health and care today. Over the next 5 years, we know that we want to make sure that people are healthier. We want to make sure that care is more consistent and high quality, because we know at the moment it varies too much. And we want to be able to make sure that we can live within our means with the resources that we've got. It can't be right that where you live will determine how long you'll live and how well you'll be. The STP tries to attempt to fill these three gaps and deliver the NHS's 5-year forward view. We now have an STP which is made up of 6 local plans. They cover each of the 6 places which form part of West Yorkshire, plus Harrogate. This means we're working together on a number of issues that affect populations across the whole of West Yorkshire. Things like smoking and alcohol, things like the mental health of our populations and suicide prevention, things like cancer and stroke, and making sure we have the best urgent care system we can have. What we think is incredibly important are the people who work for us. GPs are the cornerstone of the health and care system. One of the things we're looking at across West Yorkshire is how do we make sure that GPs and services delivered in the community are much more joined up. In doing that, we want them to be involved in decisions about how care is designed and paid for, so that we can meet the needs of vulnerable people, older people and children. Having an STP, which is based on places, I think is a real step forward in the way that we think about the delivery of health and care. That doesn't mean we've got all the answers. We now need you to engage in the conversation that we have about how we firm up the STP, how we create our plans, and how we develop something which is going to be meaningful to you, your community, and people right across West Yorkshire.
Hello, my name's Dyson. I'm Director of Healthwatch in Kirklees. Healthwatch is an organisation that listens to the views of patients and people in our local community and represents that back to the NHS and to health and social care. Healthwatch was invited to join the West Yorkshire Partnership because it was recognised that it's impossible to design good services unless we have people's views at the very heart. For example, we all know somebody who's been affected by cancer or by stroke, and we believe that by listening to those people's experiences, we can help design better services for people in the future. Healthwatch contributes to the Sustainability and Transformation Plan in 3 main ways. Firstly, we help feed people's thoughts and views into the design of new services. So we've been working to look at A&E departments and urgent and emergency care proposals. Secondly, we act as a critical friend to the partnership and we challenge them when we think that some of their plans don't represent what people really want. And thirdly, the STP gives us an opportunity to bring new issues to the partnership that we've struggled to address over the last 3 years.
Hello, my name is Professor Duffy. I am the Clinical Lead for the Cancer Programme for the West Yorkshire and Harrogate Sustainability and Transformation Plan. The West Yorkshire STP allows us to plan for the long-term good of patients across a whole population. That means essentially we can tackle some very big health issues. In West Yorkshire, 250 people a week are diagnosed with cancer, and it can be that up to 115 people each week die from this disease. What cancer patients tell us is they don't want or do not recognise false boundaries between organisations. Our job is to plan to make sure that patients' pathway of care is seamless and that for them it's a smooth movement from diagnosis through to treatment. If we successfully work together, we can realise the key ambitions for our patients. The first ambition is, if we can, prevent cancer before it even starts. 4 out of 10 cancers are preventable through lifestyle changes. For example, we'd like to see 100,000 less smokers across West Yorkshire and Harrogate by 2020. Our second key ambition is to make more cancers curable. If we can move what is currently 4 in 10 patients diagnosed at a stage when they can get curative treatment to 6 in 10, we will save at least 3,000 patients dying from their cancer unnecessarily. The third ambition is to put patient experience centre stage to how we plan and deliver our services. We want the impact and reach for patient feedback to be felt as part of the delivery of our care.
I hope you found this information useful. It is, though, only the start of a conversation that I want you to continue to be a part of.